just one day after President Obama called for an up or down vote on comprehensive health reform, Health and Human Services Secretary Kathleen Sebelius met with the insurance CEOs to talk about concerns with the industry. For a look at the administration's approach to health reform, we're joined now by White House spokesperson for health reform. That is Linda Douglas. Linda, thank you so much for joining us. We appreciate it.
Thanks for having me.
So, first of all, the insurers have made the argument that they, in fact, are not to blame, at least not to blame, for the bulk of the cost increases that we do see in the healthcare system. Government and private studies have reflected this as well. What would be the White House response to that?
Well, when you look at the rate of healthcare inflation, in other words, how much healthcare spending is going up, it's 6-7%. We're seeing these requests for rate increases at 25, 30, 40%. There was a letter that the president read when he was meeting with the insurer CEOs today that was from a woman who had seen first a 25% increase and then a 40% increase. This is nowhere near the rate of increase in healthcare spending. So it tells you that something is going on inside the structure of the health insurance industry, something that would be remedied, no question, by the president's plan that would start to shift power to consumers, would have more transparency so you could see what they're doing, how they're spending your money, right, why they're bringing the rates up. But right now, without health insurance reform, we've got to find out why they're raising their rates so high.
Well, Ms. Douglas, the CEOs of United Healthcare and WellPoint, they said they're committed to more transparency. This the comments they were making to reporters. But they also said that they felt they were able to clear up what they called misunderstandings that the White House might have. They explained that medical costs are the biggest driver of premiums, and insurers have what they said were, again, quoting, modest profits compared with other healthcare companies.
Well, you probably saw the report that said that the top 5 of the top insurance companies had record profits last year. And there was a discussion certainly with the secretary and with the president in the room for a little while about the fact that what's happening is the insurance industry is beginning to divide up the market of people who have health insurance and putting people who are people with health problems into a single group, and that does drive rates up for those people. But again, if you look at the letter that the president read aloud today, this was a woman who had been cancer-free for 11 years, and yet the insurance company was raising her rates 40%. So, of course, there are increases in the provider world, doctors and hospitals, but if you look at the overall rate of healthcare spending, that does not explain these double-digit increases, and that's why the secretary has asked them to explain publicly, to post publicly, right, the actuarial data that is behind these double-digit rate increases.
And, Linda, I'm curious, the president said he was upset with insurance companies after the increase, in particular at Anthem. What is he going to do if insurers do try to push up rates outside of the policies that are on the exchange that's been talked about? Does he have any recourse?
Well, absolutely. There are several things in the president's legislation that really would empower consumers and make sure that the insurance companies are held accountable. For example, the federal government would have rate review authority so that in states that don't have the power to take action against insurers to stop rate increases themselves, the federal government could step in and take a look at those rate increases and perhaps even stop them. It gives further powers to states that already have rate review authority. It also makes everything transparent. The consumer is going to know how they're spending your money, and it requires the insurance company to spend a certain percentage, a big percentage, right, of your premium dollars on your care. Yep. If they spend too much on profits and overhead, they've got to give you a rebate.